Hello, my name is Doctor Adrienne Phillips. I'm an assistant professor of medicine at the Weill Cornell Medicine and York Presbyterian Hospital. And my colleagues and I at this year's ASCo presented a prospective multicenter randomized study of the anti-CCR4 monoclonal antibody Mogamulizumab versus investigator's choice in the treatment of patients with relapsed refractory adult T-cell leukemia-lymphoma. So adult T-cell leukemia-lymphoma is a rare malignancy of T-cells infected with HTLV-1. HTLV-1 is endemic in Japan and the Caribbean. However, we don't see much of it in the States or even in Europe, except primarily among immigrants from those endemic countries. It has a terrible prognosis. Median overall survival for the acute and lymphoma subtypes is estimated to be about 1 year. And part of the challenge in treating this disease is, one, it's rare, but two, there's no standard therapy. In Japan, they use combination chemotherapy. Some centers use antiviral therapy. However, again, there's no standard and nothing has been shown to improve overall survival. So in Japan, they've investigated a monoclonal antibody to CCR4. So CCR4 is expressed on T cells, particularly T helper 2 and T regulatory cells, but it's overexpressed in a number of T cell malignancies. It's involved in T-cell regulation of the immune response. And in Japan, it's thought that ATL cells express CCR4 about 90%. So this monoclonal antibody has been extensively studied and developed in Japan, where it's approved for a variety of T-cell malignancies. And my colleagues and I conducted the largest prospective clinical trial in relapsed refractory ATL outside of Japan. So sites were open in the U.S., the UK, France, Peru, Brazil, and Martinique. Patients were enrolled over 3 years. And essentially, patients with ATL who had all but the smoldering subtype, if they met eligibility criteria, were randomized in a 2-to-1 fashion to receive Mogamulizumab or investigator's choice. Options for investigator's choice were pralatrexate, DHAP, or gemcitabine oxaliplatin. And the primary objective was overall response rate, and secondary objectives were progression-free survival, overall survival, and duration of response. So in terms of the results, the most notable findings were that patients getting Mogamulizumab had a median age of 55. They were more likely to be older, more likely to have bone marrow involvement compared to those getting investigator's choice, where the median age was 50.5 years. CCR4 expression was 92% in both arms, and in both arms, the primary race ethnicity of those enrolled were Black or Hispanic Latino. So the most notable findings were that those getting investigator's choice, either pralatrexate, DHAP, or gemcitabine oxaliplatin, had no responses as assessed by investigator, and there were only 2 responses for an overall response rate of 8% when results were independently reviewed. By contrast, those getting Mogamulizumab had an overall response rate of 34% as assessed by the investigator, and 28% as assessed by independent review. And there were a number of these responses that were confirmed approximately 8 weeks. And for patients who crossed over from investigator's choice to Mogamulizumab, there was also responses seen. In terms of safety, the most common treatment-emergent adverse events were infection, infusion-related reaction, and drug eruptions, which is similar to the safety profile that's been described with the drug in Japan. And to summarize, we've conducted the largest study in relapsed refractory ATL, which essentially showed there was a limited response rate to investigator's choice chemotherapy, but a 34% overall response rate to Mogamulizumab, and there was a duration of response of 5.5 months. And the most common treatment-emergent adverse events are infection, infusion-related reaction, and drug or eruption or rash. So currently ATL has no approved or standard treatment options outside of Japan, representing a high unmet medical need. And we're hopeful with this study showing clinically significant response rates to Mogamulizumab that patients now outside of Japan will have an option for therapy. So I'd like to thank the co-investigators at the 22 sites around the Western world that had this study open and accrued patients. And I'd also like to thank Kyowa Kirin Pharmaceutical for providing study funding. And I'd like to thank you for listening.